Does asbestos exposure always cause mesothelioma? Imagine a scenario where someone works in construction or has lived in an older building. They might wonder if exposure to asbestos means they will definitely develop mesothelioma. The truth is, not everyone exposed to asbestos will get this rare cancer. While asbestos exposure is the main known cause of mesothelioma, it does not guarantee that it will happen to every individual. Mesothelioma is a cancer that starts in the thin lining of the lungs, abdomen, or other organs. It is strongly linked to inhaling or swallowing asbestos fibers. But many factors influence whether someone develops the disease. For example, how much asbestos they were exposed to and for how long plays a big role. Someone with a brief or low-level exposure might never develop mesothelioma, while others with prolonged exposure are at higher risk. The time between exposure and disease development is usually very long. It can take anywhere from 10 to 50 years for symptoms to appear after asbestos contact. This long latency period makes it tricky to connect exposure to disease years later. Genetics also matter. Some people carry gene mutations, like in the BAP1 gene, that make them more susceptible to mesothelioma. Others might have a genetic makeup that offers some protection. Different types of asbestos fibers also influence risk. Amphibole fibers tend to stay in the lungs longer and are more strongly linked to mesothelioma than chrysotile fibers. People who are exposed outside of work, such as family members who handle asbestos fibers brought home on clothing or residents near asbestos mines, can also develop mesothelioma. However, these cases are less common. It's important to note that smoking does not cause mesothelioma, though it can worsen other lung diseases related to asbestos. In summary, asbestos exposure increases the risk of mesothelioma but does not make it certain. The development of this cancer depends on how much and how long someone was exposed, their genetic makeup, the type of asbestos fibers involved, and other individual factors. Preventing exposure is the best way to reduce risk. If you have been exposed to asbestos, it's wise to see a healthcare professional regularly for checkups and personalized advice. Remember, understanding your risk can help you make informed decisions about your lung health.